Hello and welcome to our first ever Going Virtual Webcast. My name is Nick Severino and I am Vice President of Marketing with First Stop Health. The Going Virtual Webcast is here to dive into the topic of virtual care. We will feature key trends, insights, and innovations from various guests each month. Now I'd like to welcome our first ever guest, Teira Gunlock, who is Chief Executive Officer at First Stop Health. Teira, thanks so much for joining us on today's webcast. But before we jump into today's topic, can you share a little bit about yourself?
Sure, and thanks, Nick. So I've been at First Stop Health for a long time, nearly 8 years. And I would say that when I came to First Stop Health, I brought two different passions. The first is around access to care. I actually grew up on a small cattle farm, spent my summers, helping with hay production, and knew that we were far removed from a lot of different great healthcare options out there. So I've always had a passion to make accessibility something that everybody can take advantage of. I've also had a great passion for patient experience. So before First Stop Health, I was a consultant for a market research company and traveled to different health systems, helping them figure out new ways to show patients that they were important and that we cared about them. So it's been a really exciting ride at First Stop Health, and I'm thrilled to be with you to talk about virtual care today.
Thanks so much for sharing. Let's get into our first segment. So First Stop Health recently launched a new digital healthcare solution called Virtual Primary Care and went live for many clients and members starting July of 2022. Virtual primary care includes First Stop Health's traditional virtual urgent care service, commonly referred to as telemedicine, which is available for members 24/7. It also includes care for preventive and chronic care issues, in which members can now schedule appointments with primary care doctors from the First Stop Health virtual practice, where virtual visits are occurring today on average within about 4 days. So with that new service, Teira, can you explain a little bit about why First Stop Health actually added virtual primary care?
Sure, Nick. So I would say that overall, we are on a mission to help people have delightful, affordable healthcare experiences. And anytime we evaluate adding a new service or a feature, we keep that mission obviously as our guiding light. But we also listen to our patients and clients. And our patients were telling us they wanted more. In our virtual urgent care practice, we were so often greeted with patients saying, "Hey, this was great, but can you also order my mammogram or help me with my diabetes?" And in that setting, which is much more short term and transactional, we just couldn't. We also knew that employers were looking for more affordable ways to care for their employees, ways to improve employee health, and ways to avoid healthcare claims. The other thing that we took into account was that the majority of people don't actually have a primary care physician these days because they're too hard to access. And that's especially true, I would say, among millennial population, which is the largest percentage of the workforce. So there was this huge opportunity for us to help our patients, meet them where they were, answer to their call to action. There was a huge opportunity for us to help employers, and there was a huge opportunity for us to close this gap in people that don't actually have access to virtual primary care. When a person does have access to virtual primary care, when they have that trusted relationship with the doctor, they're healthier and they're more affordable from a claims perspective. So a lot of different reasons that we're guiding it, but ultimately was because we wanted to help people have delightful, affordable healthcare experiences.
That's great. I'm so glad virtual primary care is now available for our members. So with virtual primary care and its recent launch, how has the implementation and launch gone so far?
I would say in a word, it's gone, wonderfully. I think, patients are just so thrilled with how easily they can, get into the virtual door, so to speak, and talk to a doctor. You mentioned earlier that patients are getting to a doctor in under 4 days on average, and that's a huge differentiator for us because on average, it takes a patient over 3 weeks to establish care with a new primary care physician. And again, that's probably why many of them don't have a primary care physician. So that's been really great to see just the feedback I would say that we get from our patients. And I would say that there continues to be a lot of learnings on the engagement side. So with virtual urgent care, we know what prompts and messaging work to get people to, in the door to make an appointment to ask for a visit with a doctor. And that comes with a lot of data and a lot of tenure in doing that. And so given that this is new, we're in that phase where we're just constantly learning new ways of saying things, what's going to work, what's really going to get people to activate and schedule a visit with their primary care physician.
So what does success actually look like for virtual primary care?
Well, I would say that it doesn't look so different from the kind of the old triple aim that has been touted for years from the Institute for Healthcare Improvement. So the triple aim in healthcare is that we want to improve the patient experience, we want to improve the health of populations, and we want to reduce per capita cost of healthcare. And so ultimately, virtual primary care, if done well, should do all of those things. I would say that, the perhaps most important metric is that really guides all of those individual elements is whether people are using it. Because ultimately, you're not going to improve the health of the populations. You're not going to reduce costs if people are not using the service. And so that is something that we track very closely. How many employees are participating with primary care? How many visits are they having? So that over time, their health will be improved and we can reduce cost.
Where do you see virtual primary care in the next couple of years?
It's a great question, Nick. I think, we aim to become more than a first stop and instead become a place to stay. And to do that, you have to not just, smooth out any issues that come with the experience. You have to truly delight people and make them feel something. So one of our taglines is that we provide care that people love. And with love comes loyalty. And with loyalty comes better health and savings because they're loyal to a person who's there to make them healthier. So there's a lot of different kind of things that we're looking at from a delight perspective, whether that's prescription delivery, whether that's other subspecialties done virtually, and just kind of continued coaching of our physicians to make sure that they're making patients feel cared for throughout every aspect of their experience.
So with the research, development, and launch and everything with virtual primary care, what are you most proud of with this new service?
I would say that, I mentioned earlier that I have this passion for patient experience and access, and those are certainly true. And I'm proud of how virtual primary care improves access and delivers great patient experiences. But when I think about like a moment that I'm most proud of, I think about one story that we had early on with a patient where she requested a primary care visit, hadn't been to a primary care doctor in years because it's just too difficult. Made a virtual primary care visit with a doctor. Doctor noticed that she was due for her first mammogram. Now, she was not, I would say super inclined to go get the mammogram just because it didn't run in her family. She wasn't too worried about it, but she thought, you know what, this doctor cares enough to tell me to do this, and I'm going to go get my mammogram. Turns out that she was actually diagnosed with very early stage breast cancer, stage 0, in fact, which was easily treatable with a little surgery. And she's on the mend now. But had it not been for the easy accessibility of virtual primary care, I'm not sure where that story goes. And so, like when I think about what I'm most proud of, it's the impact that we have on these individuals and how they move throughout the world, how they become healthier, how we can prevent illness, treat chronic disease over time. And so it's just really exciting to see. And I'm excited to collect more of those stories as we move forward.
Teira, thank you so much for joining the Going Virtual Webcast. That'll wrap this session, and we hope you'll watch next month's webcast. Thanks again, and have a great day.